Hello, nurses all over the world. My name is Nurse Felicia, and I want to welcome you to my YouTube channel. If this is your first time of seeing my video, I want to officially welcome to my YouTube channel. And if you're a returning subscriber, thank you for coming back to my channel. If you are watching this video and you have not subscribed to my channel, I want to encourage you to subscribe to my channel. So today we'll be talking about conjunctivitis. Yeah, I know someone is excited. Conjunctivitis is the most popular ocular disease worldwide. Yeah, because it's so common. Another name for conjunctivitis is Apollo or pink eye. So let's dive straight into the topic. The definition of conjunctivitis is the inflammation of the conjunctiva, as simple as that. How do we describe the conjunctiva? It's a thin, clear membrane that covers the sclera and the inner side or the inner layer of your eyelid. And the sclera is just the white part of the eye. And the clear, thin membrane that covers the sclera and the inner layer of your eyelid. That is conjunctiva. So what are the causes of conjunctivitis? So there are two causes of conjunctivitis. The first one is infection and allergy. And the infection can be categorized into two, which is bacterial infection or viral infection. Then the second one is allergy. Let's talk about the types of conjunctivitis. There are three types of conjunctivitis: bacterial conjunctivitis, allergic conjunctivitis, and viral conjunctivitis. I will talk about it one after the other. So the first one is viral conjunctivitis. It's the most common type. It's so common and it's highly contagious. It's often caused by adenovirus. The symptoms of this viral conjunctivitis include redness, itching, watery discharge, and sometimes a gritty sensation. The second one is bacterial conjunctivitis, which is caused by bacteria. It often produces a thicker yellow or green discharge. So when you see a thicker discharge, a yellowish discharge, or a greenish discharge, then you know that that's bacterial infection. It can be more severe than the viral type. Although the viral conjunctivitis is so common compared to the other two, but this bacterial conjunctivitis can be so severe if you want to compare it with the viral type. So the last one is allergic conjunctivitis, which can be triggered by allergies like pollen, pets, it can be contagious through pets or dust. And the symptoms include itching, redness, watery eyes, and sometimes swelling of the eyelids. So now I want to talk about the symptoms, the general symptoms that cut across the three types of conjunctivitis. Number one is redness of the eyes. It's either eye or eyes. Because sometimes this so-called Apollo or pink eye can start from one eye before it transfers to the second eye. Itching, burning or gritty sensation that the patient experience. Watery discharge. Yeah, you see them having a watery discharge. There's increased mucus production from the eye compared to the regular mucus that is being produced by the eye. And there's photophobia, that is the sensitivity to light. Let's talk about the pathophysiology of conjunctivitis. So conjunctiva is a loose connective tissue that covers the surface of the eyeball. It reflects back upon itself to form the inner layer of the eyelid. I hope you get that. And the conjunctiva family adheres to the sclera. I said it earlier that the sclera is the white part of the eye. So sometimes you might not even be able to differentiate it. So the family adheres with the sclera and the limbus, where it meets with the cornea. The accessory lacrimal glands, along with the goblet cells, they are contained within the conjunctiva. So we have the lacrimal gland and the goblet cells inside the conjunctiva. And what do? They are just there to lubricate the eye. All right. So as to any mucous membrane, whenever an infectious or allergic agent adhere to the conjunctiva, because the conjunctiva is also a mucous membrane. So whenever any infectious or allergic agent adheres to this conjunctiva, the defense mechanism is broken. And once the defense mechanism is broken, what sets in? Inflammation. There's an inflammatory response, which bring about the symptoms that we have mentioned: redness, swelling, some irritation setting. So those are the inflammatory response that happens during this. And let me start from the viral. Viral will always take its course. 7 to 14 days, you're going to take its course. The bacteria, if the patient takes the adequate antibiotics, then it's resolved. And the allergy, once the allergy is taken away, then the patient is fine. Obviously, that's just, it's as simple as that. The patient is fine. So, and it can be complicated if the patient did not seek adequate help, or if it's not properly treated. It can lead to more damage of the eye. So that's all about the pathophysiology. Let's talk about the diagnosis. The diagnosis of this pink eye or Apollo or conjunctivitis is that it's usually diagnosed with history or physical examination. Obviously, when you see somebody with conjunctivitis, it's so easy to know that, no, this person is having conjunctivitis. So it's when you now take history or you do your physical examination that you'll now be able to differentiate if it's viral, bacteria, or allergic conjunctivitis. So let's move to the treatment of conjunctivitis. How do we treat viral conjunctivitis? It's resolved, like I said earlier while I was talking about the pathophysiology. It's usually resolved on its own within a week or two. So, and you can just apply cold compress, or you can use over-the-counter medication, antihistamines, can also help with the symptoms. And if the patient is having too much pain, then you can consider giving analgesia. So that makes it manageable, like it can be managed, the viral conjunctivitis. Then let's move to the bacterial conjunctivitis. It's often treated with antibiotic eye drop or ointment. So for the bacterial conjunctivitis, the patient is prescribed antibiotic eye drop or ointment. Then the third one, which is the allergic conjunctivitis, over-the-counter antihistamines, eye drop can help. And the most important thing, or the crucial part of it, is that avoiding the allergens it's so important, because the more you come in contact with the allergen, then it won't go away. One thing about the allergic conjunctivitis is over-the-counter eye drop or the antihistamine can resolve it. And the most important thing is you must move away or you avoid coming in contact with the allergen. So that's just it. I'm going to move to the prevention of conjunctivitis. Good hand hygiene. This cannot be overemphasized. Good hand hygiene is so important. And you avoid touching your eyes. That's also important. The eye is so important sense. When we want to talk about the 5 senses that we have, the eye, I must say, it's the most important to me. So you don't want anything that will jeopardize that sense of sight. And using clean towels and handkerchiefs, it still boils down to hygiene. And the last one is you stay home when sick to prevent the spread of the infection. And the most important part is If you experience severe pain, vision changes, you're having blurry eyes, you have to consider going to ophthalmologist, like an eye care specialist. Because as much as we are saying that this conjunctivitis is so common, it's the most popular ocular disease all over the world, but it's still something that you can still manage. But if you now see that within 48 of 72 hours, the patient is not getting better, then you want to refer the patient to an eye specialist. So let's talk about the nurse's role. What are the nurse's role in the care of patients with conjunctivitis? The first thing is assessment. You have to assess your patients. You have to, how do you do that? You have to conduct initial assessment to identify the symptoms, determine the severity of the condition, and to rule out any other potential causes. So you want to know, oh, is this viral? Is this bacteria? Is this allergic conjunctivitis? Part two is you education. You educate your patient on the causes, the symptoms, and the treatment option for conjunctivitis, as well as providing guidance on self-care and preventive measures. So you want to educate your patients on the symptoms, the cause, at least let them be aware of their disease condition. Then the third one is medication administration. You administer medication as prescribed, such as antibiotics or anti-inflammatory eye drops. So you administer prescribed medication as long as they are in your care. Then you can also do eye irrigation and cleaning for the patient in case of there's prevalent discharge, either greenish, creamish, yellowish discharge, or a clear discharge. You want to do eye irrigation and cleaning for the patient. And how do you do this? You assist with eye irrigation and cleaning to remove discharge and promote healing. Yes, because the discharge sometimes they are very sticky. The patient might not even be able to open their eyes. So you want to help with that. Then you also help with pain management. I said earlier that when the patient complains to you that the patient he or she is feeling too much pain, then you want to encourage analgesia. You provide pain relief measures such as warm compress or analgesics to manage discomfort. Then you want to prevent infection. And how do you do this? You do infection control. You implement infection control measures to prevent the spread of infection, which includes proper hand hygiene. The most important thing is you encourage proper hand hygiene and overall hygiene of the patient. You also encourage that. Then you tell the patient to avoid touching their eyes. This is part of the preventive measures. Then monitoring. You monitor patient for signs of complication such as increased redness, swelling, or vision changes. I said it earlier that if a patient is telling you that they are having blurry eyes, they can't see very well, problem with even identifying colors, shapes, you want to take adequate measure, you know that the complication is setting in. Then after you have monitored and probably you discover that something is going wrong, then you do your appropriate referral. You refer the patient to specialists such as ophthalmologists if necessary. So you have to do referral of the patient. Then don't forget that when you care for your patient, you do your follow-up care. So how do you do this? You provide follow-up care to ensure the infection has cleared. You want to know if the patient is doing well and to know how they are faring here. So you can do that. Follow up your patients by making sure that the infection has cleared off. Then your documentation. Yeah, it's so important. And I want you to take note of this. You document accurately. And how do you do this? You accurately document patient assessment, the treatment, everything. In short, everything you have done for the patient, you make sure that you document. You make your adequate documentation. Okay. All right, so we've come to the end of this topic. If you have any question, please let me know in the comment section. And if there's any topic you want me to take that you're finding hard or you're finding it difficult to comprehend, please don't forget to use the comment section. Thank you for listening to this video. I want to appreciate you. And until the next time, I remain Nurse Felicia. Bye bye.